Recording is started. The meeting is started.
All right. If you bow your heads with me for the invocation. Jesus says in Matthew's gospel, "Are not 2 sparrows sold for a penny? And not one of them will fall to the ground apart from your Father. But even the hairs on your head are all numbered. Therefore, fear not. You are of more value than many sparrows." Lord, we heed those words today. We trust you and you alone in these uncertain times. We know that you know how this ends, and we know you are good. So, Lord, allow us to serve humanity, allow us to love our neighbors, and allow us to see what is good and right in this world and advance those ideas in your kingdom. Lord, we pray for our medical professionals here in Hudson and around the world. Lord, protect them, keep them safe, allow them to serve in a time where they are certainly afraid. I know I would be. So Lord, we trust you in that. May this meeting be a blessing to those here, and may you bless those who aren't. In your son's name, amen.
Amen.
Amen. Thank you.
Yeah.
And would please join me.
This is Tom. I joined via phone here.
Okay. Thanks, Tom. I pledge allegiance to the flag
of the United States of America and to the republic for which it
stands,
one nation, under God,
indivisible, with liberty and
justice for all. And as Rotarians, in the things that we think, say, and do, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? Randy, I'll toss the meeting to you, sir.
Happy quarantine, if that's something you're excited about. I doubt it, but. So, who's happy? We'll do a happy bucks. Nobody's happy. Chuck.
Excuse me, I do have to let everybody know that per Brian's request, I did mute everybody to keep the volume and background noise down. So if you'd like to speak, please unmute yourself. And then when you're done speaking, go ahead and mute yourself back on again.
As I have done. Can you hear me?
Yep, you're on, Chuck.
I wanted to share with you something that happened this last week. Dave Fox is a retired civil engineer down in Ames, Iowa, who's very active with the water projects that we've been doing down there the last 6 or 7 years. He got a message from Gilliard, who is the project manager in Tanzania on the projects. Gilliard is also a social worker working for a church down there. Gilliard indicated that he had a need for resources as a result of the pandemic. Dave Fox sent out an email to, I think there were 29 names on the list, basically people who have been active with the Tanzanian water projects, myself included, simply asking for anyone who would wish to do so, please commit a dollar amount to him, and he would see that on Monday he would transfer funds to Tanzania so that Gilliard had the funds available to meet the needs of the, I think there are 15 families involved. On Monday, he transferred $1,400 as a result of a simple email request to his contacts. I thought that was interesting and speaks very, very strongly to me about the power of Rotary.
All right, thank you, Chuck. Anybody else happy today?
Have a happy buck or two. As Mary mentioned, I'm happy to report that I was elected to the county board. I'm also happy that the election itself is done. It was definitely a challenging election cycle for any candidate and any voters trying to go to the polls. So, that's something we hope we won't have to face again. And also, following a Rotary presentation we had probably a couple months ago now from Habitat for Humanity, I actually connected with the group, with the board, and was recently added to the board of directors for Habitat for Humanity. So I'm happy about that. So
Wow.
I don't know where to send my $2, but when we get back together again,
Just give it to me.
I'll give them to you. All right. So yeah.
Nice job. Thank you, Kara. Anybody else? Happy dollars. Seeing none, we'll go to announcements then. Any
I don't
announcements?
I'm
None?
not having any this week, Randy.
All right, Rotary Minute.
Yeah, so I'm just caught off guard here. I apologize, Randy. But there's been a lot of things that Rotary clubs have been doing worldwide for their local communities due to the coronavirus and COVID-19 and quarantine. There have been reports and news stories about Rotary clubs reaching out and doing very similar efforts to our own. For those of you who don't know, we have the Hudson Community Coronavirus Response effort, where we are basically playing matchmakers between volunteer opportunities to those who want to volunteer right now and those who have needs in the world that we're in right now. And so that's a valiant effort. I've heard stories of other Rotary clubs that have made partnerships with their school districts who recognize that their schools will not be open for a month, probably till the end of the year at this point, and pulling the toilet paper and all the necessary, hygienic and medical supplies from those facilities and getting them to the hands and the families that need them at the moment. And knowing, of course, full well that the school districts will be able to replenish those supplies over the summer months when they're not needed. But there's some pretty unique stuff out there right now, and I want to give it up to all the Rotarians and all the local groups outside of Rotary in every community worldwide that they're really expanding on their creative skills with regards to problem solving. So kudos to all the Rotarians and really just everybody stepping up and becoming localized heroes. And that is my Rotary Minute.
Thank you, Isaac. Brian, do you want to say anything about that committee that the Rotary clubs are? You want to just touch base with that, or are we pretty good with that?
Well, I think I've passed along the information and the connections to the website in terms of kind of what's going on. Just so happens that both Ruth Petterman and our guest speaker Paul McGinnis have been part of that team that's been building that really effort from their side. I think Tricia Christensen in particular has been instrumental in building the software structure behind it to get the web pages up. A lot of effort by Chris Wood and various folks to be reaching out and contacting. We're trying to work with United Way, 211, Operation Help to kind of create, like Isaac said, that opportunity of us trying to not only get information out there in terms of what resources are available, but also then trying to marry up need with volunteers who can help assist. So there'll be more updates. I would ask that you kind of periodically check check that web page. It's getting updated regularly with additional asks that come in, as well as if you are one of those people that can volunteer to do some of the things there. Clearly, some of us are not in that mode, but some of us can. Please fill out the online form there that goes directly to Operation Help. So appreciate any support that our club can give to that.
Thanks. Okay, Brian. And one more thing is that Joel Skinner is celebrating a birthday this month. Let's not forget that, Joel. How old are you? Or how young are you? I'm sorry.
He's muted.
Happy birthday, Joel.
I don't
Where are
want
you, Shelley? Thank you. Thanks, Shelley.
I'm not sure singing would be the best on Zoom. So with that, Brian, that is it. I don't know if you want Isaac to introduce the speaker.
Yes, Isaac, please do so.
So I do see Paul over there. Paul, go ahead and unmute yourself at this time. And if you're not a speaker, then please mute yourself. Paul McGinnis has been a member of the Hudson community for the past 32 years. He recently retired from Hudson Physicians. He began his medical career with medical school at Creighton University in Omaha, Nebraska, and completed his family medicine residency at St. Paul Ramsey Medical Center in St. Paul, Minnesota, now Regents Hospital. He has been involved in quality and health IT work while maintaining a primary care practice. His wife, Christine, and he have 3 children who graduated from Hudson High School. Currently, he serves on the St. Croix County Health and Human Services Board as an appointed physician member. He is part of the Hudson Daybreak Rotary Club. Here to share more about the efforts that both clubs are doing on the Hudson coronavirus response is Paul McGinnis.
Well, thank you, everyone. What I'm doing is kind of repeating a talk that I did for the Daybreak Club last week. It talks a little bit about what's happening with this whole coronavirus thing on a broader scope and what we know, and actually a lot of the stuff we don't know at this point in time. So just trying to give people a chance to kind of get up to speed on some things, and then as folks have questions, please feel free to put them in on chat, and I'll try and pick them up as we go along here. And I noticed, I think Tom is on the line, so if he has an update from the hospital, I know Greg Young had done one for the Daybreak Rotary Club just yesterday on some of the efforts in the clinic and the hospital, and that was well received, and I think important for members of the community to hear how the local healthcare establishment is responding to this really unusual situation. So, coronavirus, a little background. First cases were reported in mid-December in Wuhan, China, as everyone knows. The actual first clear case was December 31st. Initially, it was diagnosed out of a seafood market, and the virus, the coronavirus itself, is related to a variety of cold viruses and also some other epidemic viruses that we've had in the past. It actually is very closely related to a virus they find in bats, so there may have been a crossover from an animal type to human, which is one of our big concerns. It was actually formally named on January 12th by the World Health Organization, and the World Health Organization formally declared it an epidemic January 30th, which was also the same date of the first US case. So long story short, this thing has only been around for 2.5 months, so not very long at all. There's been a couple of other big coronavirus infections in the past. There was the SARS epidemic in 2002 that fortunately didn't go nearly as far as this one. And then also MERS, which was came out of the Middle East in 2012. So these were also in the same type of virus. But neither of these tended to be as virulent or as spreadable as the coronavirus is. So while they did cause quite a number of deaths and a number of infections, it was nothing like what we're seeing today. I know for both SARS and MERS, the clinic and I believe the hospital also were on alert. There were some screening questions we asked people routinely back in those years. But fortunately, it never made its way into the community here or much of the way into the United States. It's an RNA virus, so people remember the high school biology. This is RNA. It's different than a norovirus or influenza virus or hepatitis virus or the HIV virus. So again, just a little different than those. Currently, where things are at in St. Croix County, at the end of last week, we were at 7 cases. Now we are currently at 11 cases out of St. Croix County. However, this is likely a dramatic undercount, as I'm sure as people have heard. A comment that I've heard routinely is that you could add a 0 to that number and you'd probably be have a much better estimate of what the actual case burden in St. Croix County is. And it could be even significantly higher than that. We just don't know. And that's the hard part. And I'll talk about that a little bit more lately. As I was looking at information and kind of preparing for this, so far in St. Croix County, we've not had any reported deaths. So that's great news. Long story short, the numbers overall in St. Croix County are low, and we're hoping that the social distancing is working, that we are actually flattening the curve. And I'll come back to that in a little bit as well. Specifically, everyone sees the numbers. I thought it was interesting when I prepared this conversation for last week. Wisconsin was at 2,700 cases. As of this morning, it was 3,700 cases. So it's been 1,000 cases in the last week. Deaths have gone up and doubled in the last week, so from 90 up to 180. Most of those are down in the Milwaukee and the Madison area. May well be because of the proximity to Illinois. It may well also be because of the fact that those areas tend to have a higher African American population, which tends to be a little more vulnerable to this disease, along with their elderly populations. Minnesota, for comparative, is at 1,800 cases and 87 deaths, so half or less of what Wisconsin is. So what they've been doing has been working, and I think that we here in St. Croix County and in Hudson have benefited from some of those because we had this close relationship with the Twin Cities. I also found it interesting that overall the U.S. cases, 600,000 with 28,000 deaths. And just so people remember, this feels like this has been going on forever. 4 weeks ago in the entire United States, there were only 97 deaths. There are now 28,000 deaths. So this is classic for what a pandemic like this will do. It just explodes and the death numbers rise dramatically unless you can flatten that curve. An interesting thing that I've found on the internet is both Google and another organization called Unicast have been doing some work with location data tracking. So if you have Google on your phone and you've got the location data turned on, they've been using that reportedly anonymously to clarify tracking data, and they actually have sliced that data all the way down to the county level. So I found it interesting. In St. Croix County a week ago, there was a 53% decrease in the amount of movement of cell phones into retail or recreational spaces. This week it's at 43%, so it's dropped back a little bit. Parks were down by 21% last week. They're up 5% this week compared to the baseline period of January 3rd through February 6th. So more people are getting out to parks, which is good for getting out and being outdoor activity, but the key thing is that social distancing and staying apart. So if the kids are in the parks playing football or playing all together on the playground, that's not a good thing. If they're staying apart and families are just enjoying being outside, that's great. Workplace numbers pretty consistently down at about 34 to 32%. Groceries and pharmacies down about the same amount, and people staying home about 24%. About a quarter people. Now this is just if you have the location data on. So the data is a little suspect here, especially on the increases in the parks numbers. Those are all over the map. But I thought it was just interesting, indicating how much we have changed our activities and our behaviors, and also interesting how technology can be used from a public health standpoint. It's reportedly not being used for enforcement, but if people have concerns about this, just turn your location tracking off, and that will take you out of this mess, supposedly, at least according to what the websites say. So with this disease, we know at this point that there's pretty hard evidence suggesting that as many of a quarter of the people who have coronavirus don't have any symptoms. So those folks aren't coughing, they don't have a fever, they don't have the loss of sense of smell or taste. And there's some interesting information I heard just in the last 24 hours about a hospital where they had tested every woman coming in who was pregnant and coming in to deliver. So they tested 200 women. Of those, about 40 of them were positive for coronavirus. Of those 40 women, 90% of them, so 36 of those 40 women had no symptoms. So that was even more concerning than that quarter. So whether that's related to how far it's spread in our population, or whether it's related to the fact that there's something different with pregnancy, nobody knows yet. But that was, again, you can have this thing infect people and never know that it's been there. We do know that children can get the disease, but they don't tend to need hospitalizations or die. So that's great news. And that's a really big thing for the community. The biggest reason the schools were closed was to try and cut down the potential for the kids to infect other kids, who then go home and infect their parents, who then go to grandma and grandpa's and infect grandma and grandpa, and just trying to, again, interrupt that whole cycle. People over the age of 65 or with chronic health conditions, those are the people who are most likely to die with this thing. But it does not totally absolve younger people from risk either. So they're at risk of getting sick, but they can die, but they just don't do so nearly as often as those folks with chronic diseases such as heart disease or diabetes or lung disease, asthma, smoking. And right now they're including vaping in with the smoking. We don't have the research to sort that out quite yet. Early suggestions, and again, I think this is becoming more and more clear, is that there are more deaths in the African-American community. So if you're elderly and African-American, or if you're in the African-American community, you have a higher probability of dying from this disease than if you were Caucasian or white, as I am. Right now, we don't know why. At least I'm not seeing anything that's saying why. There's people talking about it maybe due to more crowding, due to socioeconomic, maybe that they have more chronic diseases, they may have less access to healthcare, or it may be something that's related to their ethnicity, and that all has not been teased out yet. There's pretty good suggestions now that China underreported their data, that their caseloads actually may have been quite a bit higher. There's also some pretty good evidence that there may be a lot of deaths related to this virus that have been missed. In many cases, in other cases, there may be some excess deaths that are being reported. So in other ways, this is all relatively recent, and the numbers are likely going to change. The good news is that some of the death rates in Italy and the new case rates in Italy and in Europe have begun to flatten. Wuhan has reopened, so in those areas where it hit first and somewhat the hardest, we're seeing some positive things. We're not quite there yet in this country, but there's hopes that we'll get there at some point in the future here. So spreading this thing, again, as everyone's heard, it's primarily hands and face. It's primarily contact. So it's your hands up to your face, to your mouth. It's your hands to somebody else. It's your hands to, unfortunately, actually a surface that can spread this thing. Coughing, talking, singing actually can be a source. They found a choir out in Washington there where nobody was ill. They had a choir rehearsal, and within a few days, 30 people were ill out of these 50, 60 participants, and 2 of them unfortunately died. The meatpacking plant in Sioux Falls is another case where there's been a huge explosion of cases recently. 6 feet is recommended, but that's actually based on fairly old, fairly limited data. The stuff I'm seeing and thinking is that 10 feet is probably better. So if you have a choice between 6 feet and 10 or 12 feet, I'd do the 10 or 12 feet. If you've ever watched the videos of people coughing and how far those particles spread, that's what we're talking about. And it may be in the air for up to 3 hours. So if somebody coughs and then you walk through that area within the 3 hours, there's a chance you could get it. So that's where you saw the CDC recommendation on masks that came out, and we'll talk a little bit about that in protection. Surfaces, it can be on hard surfaces like plastic, metal, things like that for 2 to 3 days. However, there was a cruise ship where they found viral particles still there 17 days later. Cardboard, about 24 hours. People are now pretty much saying that groceries are probably okay, but after you handle them, you should be washing them. You don't have to wipe off all the groceries, but wash your hands after you're done handling them. Wash produce and fruit as you typically would, not so much from the virus standpoint, although there's lots of other diseases that can be on those things. Food is generally safe, so the restaurants, the takeout, things like that is pretty safe. Water is safe. It's generally not transmitted what we call fecal orally, so hepatitis is transmitted fecal oral as opposed to droplet and coughing. This is a droplet and coughing type transmission. Incubation is 4 to 8 days, so if you are exposed, it's 4 to 8 days before you're going to develop symptoms. If you develop symptoms, and as you remember, I said as many as 25% of people may not, and that number could be higher, might be lower, we just don't know at this point in time, but there's a lot of people who have it who don't have symptoms. They also recommend that you isolate for 14 days. And that's just, again, to protect people in case you've been, have contracted it and don't realize it and don't know it and don't have symptoms. It's not as virulent as measles may be. So we know measles is a little more likely to spread, but it's more virulent or more likely to spread than other things such as chickenpox that we all remember from our youth, or at least I do because I'm old enough. So what about protection? Long story short, at the end of the day, the best medicine that we have is staying safe and staying away. That social distancing, which actually a lot of people said we really should have called physical distancing, because socially we should be connecting, but physically we should be at least a good distance apart. And especially if you're over 65 and chronic diseases, you should be staying home, minimizing trips to just essential trips. Hand washing is really important, and I think that probably is underemphasized in all of the messaging that we hear. Soap and water is best, sanitizers are second, but hand washing is really, really critical. Cover your cough, but not with your hands. Don't touch your face. We talked about the distances. Staying at home is the best way to distance. I mean, really, stay at home. It works. If you've had an exposure, possible exposure, if you've been traveling, if you've had a work exposure, if you have mild illness of any type, then the recommendation is to self-isolate for 14 days, and that means 14 days with no contact. So not having the friends over, not visiting the family, those kinds of things, just really staying all by yourself, again, trying to avoid interrupting the spread of this through communities. There's some controversial issues. Masks. 2 weeks ago when I put this whole thing together, that morning they came out and recommended masks, but before that it was pretty hotly debated among the experts. And masks are primarily designed to protect others from you, not you from them. So the masks, unfortunately, don't do a great job of filtering the viral particles, but if you happen to cough or sneeze, they're pretty good about intercepting a lot of the droplets so that you're less likely to leave a lot of virus hanging in the air for somebody else to walk through. So long story short, we wear masks out in public primarily to protect others in case we have had the disease, and that's the biggest reason. A couple times I've been out in Hudson, I think we could do a lot better with putting masks on. The cloth or non-medical masks are what are currently recommended, because the medical masks, especially the N95, should be really utilized for the healthcare workers and for ill patients. So that's where the recommendation is at this point in time. Gloves, you see a lot of people wearing gloves. I'd rather see a lot of people wearing masks than less people wearing gloves, because gloves most of the time are not used correctly. So if you see somebody in the store and they put on a pair of gloves and they go into that store and they handle a bunch of things, and then they go to the next store and they handle a bunch of things, and they go to the next store and handle a bunch of things, now they've potentially spread that virus to multiple locations, as opposed to using hand washing or a hand sanitizer in between. Most people also don't take them off correctly. When you take a glove off, you're supposed to turn it inside out, put the one you took off in your gloved hand, and you turn that one inside out over the top of it. Now you have this neat little bundle you can throw away. The nice thing about gloves is, though, they kind of remind you not to touch your face. So that's a good thing. The masks do the same thing too. That helps. The key thing with them, if you're using them, is making sure you're changing them properly and correctly. So after you come out of the store, take them off before you get into the car, hand sanitizer, then you go ahead and do your thing. Go on, drive home or wherever you're going to next. Hydrochloroquine, lots of noise about that one. Unfortunately, it's still too new. Lots of studies going on. We don't know if it makes a difference. One small study said maybe. There was another study that said not. So there's a lot of noise based on this one, but unfortunately it's based on pretty little data. There are some antiviral treatments that are showing a lot of promise. Those are also in a lot of trials. So there's a lot of information that will bubble up over the next weeks and months about what's the right thing to do. Hydrochloroquine is being used in a lot of hospitals simply as a last-ditch effort. Its ability to prevent coronavirus is totally unproven, and at this point I would say is probably not a good idea, because there are risks with this medication. So how do we get out of this? That's the big question everyone's talking about. At this point, my best guess is that it's going to be another 4 weeks, 3 to 4 weeks before we see significant loosening of some of the social restrictions. At least I think that would be, at this point, probably easily the safest idea. We know Minnesota extended their stay at home out to the 14th, and I'd be pretty surprised if Wisconsin doesn't do something similar in a similar time frame, although the governor has not acted, so I don't know what will happen there. Has the curve flattened? Public health people I talk to are cautiously optimistic that in our area, which is the Twin Cities Metro, St. Croix County, Hudson, that indeed we have been successful flattening the curve. We don't know for sure, but they're hopeful. The hard thing about this is that if you remember those charts that everybody saw at the beginning of this thing, if you get the epidemic spread, it looks like a straight up mountaintop. If you could flatten the curve becomes more like a hill, long and slow, but it has a longer course. So if we've actually flattened the curve, it means that we're going to have to stay that longer course. And that's the important thing. The good news is we don't overwhelm our healthcare system. We don't lose nearly as many people. We don't get as many people sick and on ventilators for a week, and then with other types of chronic diseases that can occur as a result of having this virus. So long story short, because we flattened the curve may mean we need to be socially distant or physically distant for a little longer period of time, and that's hard. That's hard for businesses, that's hard for people, that's hard for kids, that's hard for families who are stuck at home with their kids. It's tough all the way around. The concern is if we come out of the social distancing, this physical restriction, physical distancing too soon, we could move into one of those spiked peaks pretty quickly. So it's only been 12 weeks since this thing began in earnest. It's only been about 3 weeks that we've actually been safer at home. The governor declared that recommendation on the 24th of March. So the hard part is it's the time for us to all be patient. And that's, as I always tell people, that's the hardest prescription to give and the hardest prescription to take is patience. The social, physical distancing, and then when these restrictions come off, I expect, and I'm not the public health expert or an epidemiologist, but I suspect that they're going to be taken off slowly. So there'll be little things here, little things there, as opposed to everything opens up all at once. There's been a lot of conversation about really large gatherings of thousands of people being not allowed until actually 2021. So we'll have to see where that goes. Vaccine, there's lots of questions about that. At the earliest, it's going to be 18 months out, likely 2 to 3 years. By the time they figure out one that works and works consistently, doesn't cause problems. So it's going to be a while for that. If a vaccine could be developed in 18 months, that would be the fastest ever that a vaccine has been created and developed and released. The other concern is this could be recurrent. So we could see another wave in the fall, in the summer, we don't know when. And I think the other key step is to learn from this one what we didn't do well and be much better prepared next time. So those are a couple of comments I have. Certainly if there are questions, and I know, Tom, are you still on the line?
Yes, I am.
Would you be willing to share a little bit about what the hospital's doing?
Comments. By the way, that was absolutely. By the way, that was an outstanding update. Thank you, Dr. McGinnis. So not really a whole lot new since last week when I gave my update, but just want to give everybody, I guess, kind of a refresher at the hospital here. So we don't have any COVID cases right now at the hospital. And I think the thing that really merits some emphasis is we've been collaborating very closely with Hudson physicians. We meet with their CEO daily. Of course, we talk to their physicians, and I think we're very well choreographed in our response. We've implemented patient visitor and employee screenings. We've got visitor restrictions in place. We have our essential workforce guidelines that we're following. We're using universal masking, which basically means that everyone's wearing a mask regardless of role or rank in the organization. We've got employee health screening, reuse of our PPE guidelines. We've canceled all of our elective surgeries and procedures. We canceled our volunteer program, all of our classes, other non-essential type things such as deliveries. We're coordinating with the state, federal agencies, the CDC, Department of Health, city agencies, county agencies as well. I think the main thing to really point out there is I can't even think of any loose ends. I think we've been coordinating and collaborating as much as we possibly can with all the right folks. We've got our surge plans. That's in the event of a tier 2, 3, or 4, where we see an influx of patients. We've got all those plans at the ready. We have our incident command is still in place. We're coordinating with them on a daily basis. So the bottom line is things are pretty slow at the hospital right now. We're taking all the appropriate measures. We're prepared for anything that comes our way. And I agree with Dr. McGinnis's assessment. It's kind of hard to predict how this is going to play out, but I think it's much more of a hill and a prolonged pain, if you will, rather than an episodic kind of thing. So however it plays out, we're ready and we're coordinating. And from my own personal perspective, that's probably been the most remarkable thing. It's just been the depth of collaboration and how everybody's come together. And it just makes me proud to be in the community. It really does.
Question for you.
Any
Paul?
questions for?
Oh, sorry.
Yeah.
Yeah, I don't know if you know, Paul, but if you've got something on plastic, it says 3 days and it should be dead, right? Set it aside for 3 days. Well, if I put that in the refrigerator, does that slow it down, or does it come alive again when you pull it out?
Yeah, I think at this point, the best information, because I had exactly the same question, the best information I'm seeing is that the 3 days is the 3 days either in the refrigerator or out. So long story short, that's the best guess. I haven't seen data to suggest otherwise.
Thank you.
One other just quick comment. I know I'm listening to Greg Young, who gave an update to the Daybreak. Part of the challenges for the clinic, and I think also for the hospital, is just the fact that things are really, really slow. The elective surgeries are canceled. They're having to furlough some staff, and that's made it really, really tough. So they, as a business, in the middle of the epidemic, are actually suffering as well. So it's good that they're ready, but it's hard that they're in the situation as so many of the rest. I know that the clinic has created a separate Station 5 upstairs that is entirely for people who are acutely ill. And so if you're coming in for routine care that can't be avoided, then the waiting areas you'll be using will be different and separate and physically different from those areas where people are ill. So they're trying to screen folks as they come in and get them to the right spot so that they decrease the risk for everybody concerned.
And we have, just to tag on to that, we have physically rerouted traffic in terms of stairwells and entrances, and we've got screeners, and everybody's fully masked. And to Dr. McGinnis's point, urgent care now being moved exclusively to second floor, Hudson Physicians. We've had to reroute our employee traffic. You also had commented too about furloughing staff. We have a very complex and comprehensive plan that we're working on right now for low need. I just want to, if you could, just keep all the staff in your minds and hearts, because this is it's gut-wrenching when we have to make decisions in terms of essential staffing and low need and that type of thing. It impacts people, obviously, in their livelihoods and such. So we're doing everything we can to minimize that for our staff, but just obviously we have to look at the business aspect as well. Just like many of you who are in your respective businesses, we have to make decisions that aren't easy, but it's what we have to do nonetheless. So we're right in the middle of all that right now, and it's very troublesome.
I have a question here from Brian wondering, where do you think we'll be by July 1st or August 1st? And boy, if I could figure that one out, I would be really a fortune teller. I think at this point, we just don't know. Hopefully, I would expect, especially if we continue to flatten the curve, that we would be back to some levels of activity, probably with some amount of distance in between them. So take the example of a restaurant. They might be open, but they might be reducing seating so there's at least 6 feet between tables and things like that, so that your party is not next to another party. I think that we will still have some fairly vigorous protections around our elder facilities, because those are where the huge vulnerabilities are. So if the virus gets loose in one of those facilities, then you're starting to talk people dying. And that's the big worry for folks like CCH or Wintergreen, Pine Ridge. I do know Pine Ridge had a positive employee, but they've been isolated, and they think that and then they isolated that particular area that the employee had been in. So, those are the things that are concerning. So the other thing I think that is worrisome is we may end up taking some of the restrictions off and then seeing a spike and then putting restrictions back on. So if I were running a business, I would be planning for a potential reinstitution of some of these physical distancing requirements as much as you're able to, having already gone through this pretty difficult phase right now.
Paul, I had a question.
Sure.
Actually, more of a comment. A number of days ago, I've forgotten which day it was, but Minnesota reported 11 deaths. And of those 11, 3 were in their 70s, 4 were in their 80s, 4 were in their 90s. And as you follow the news, you'll notice that there's an awful lot of congregate living facilities that see outbreaks. The Chicago Cook County Jail, for example, is one of the hugest ones, but it's very common in nursing homes across this country. I have a question about the nursing homes in St. Croix County. are they testing the staff and the residents in those homes, or are we waiting for something to happen?
Yeah, so the challenge is right now there's simply not enough tests to do that kind of testing. I do know that they are screening staff, so they do check all the staff's temperature as they come in, and staff are being encouraged and required that if they're ill, they should not be coming to work, and that's been pretty solid. The residents are certainly watching for anybody to get sick. I know that the facility my father's in, they do daily checks, so they're checking on him every day to make sure he's healthy. They're not entering the place, they're masking, they're doing all of those types of things. Since you brought it up, I'm just going to spend a couple minutes on the testing, and I'll come back and finish answering that question about the testing, Chuck.
Okay, thanks.
Yeah, the first thing is that, frankly, as a country, we blew it early on. We didn't get the tests out, we didn't get the volumes out, we didn't ramp them up fast enough. There'll be more post-mortem on that one, but long story short, at this time, we still are very limited in testing, and I believe, if I understand it correctly, it's primarily for hospitalized patients or people who have significant health risks that may be getting tested. They're starting to get to the point where they're thinking about being able to open it up a little bit, and I'll talk about that in a second. Oftentimes they're testing for influenza, for RSV, for other things first, although the influenza rates have really dropped off, so that particular surge, I think, is pretty much calmed down, although sometimes we'll see it perk back up a little bit as we get into April. That occasionally that will happen. Long story short, testing, if the patient has mild symptoms, there's really no benefit to knowing for sure that they have coronavirus to them. The treatment stays the same. You take medications to control symptoms, you isolate, you stay home, and then your family also has to isolate on that one. The benefit is to the community of who all you were out there, and the whole question of who did you come in contact with and tracing that all out. There's been a lot of conversation about testing. There are 3 types of tests to remember. One is a diagnostic test. That's a standard test that takes anywhere from 2 to 7 days to come back. I think in Greg's comments, he was mentioning that it's probably getting down towards the 2 to 3 days now, whereas week before was at this 5 to 7 days. Second thing is there's a rapid test that is just beginning to make it into the systems. Some of our advanced tertiary facilities have that test and are using it. The primary utility of that test is you can test a patient coming in who's seriously ill with a respiratory disease, and if they don't have coronavirus, now you can put them in a much less, require a lot less personal protective equipment. You can save those resources for those patients who you need to protect your staff from. So that's primarily staff utilization. The third test that you hear a lot of conversation, the U of M and Mayo are working hard on this one along with lots of other places, is this antibody test. And that's the test to figure out if you've had it in the past. The FDA has basically passed a whole bunch of tests out without a lot of their typical oversight. So there's the tests that are hitting the market really, really early. Basically, the people that I read are saying these tests are probably not worthwhile because they're going to have a lot of cross-reactivity. So remember, the common cold is also a coronavirus. So if your test isn't very good at sorting out the types of coronavirus, you can tell somebody they're immune or they're protected, and they're not. The tests that Mayo, that the U of M are working on, those have not been launched yet, but I think those tests are going to be much more reliable. The problem is does that antibody immunity protect you, and for how long? And the best evidence so far is suggesting maybe a year, occasionally 2. There's some concerns that if you get mild disease, you may not actually mount much of an antibody response, and while you tested positive, you may not have adequate protection. So there's a lot that has to be learned about this whole antibody test before it really becomes a viable alternative. And that's going to be at least a couple months in the future before we get, and then the whole question of scaling it up to, to assessing 300 million people. That's not something that happens overnight. If you were to take your business, any of you, from what you do today and scale it up to 300 million customers, that's going to take a lot of work and a lot of energy. And that's kind of what the healthcare and testing community is facing at this time. Somebody asked a question about the plasma, what's called convalescent plasma therapy. Otherwise, if you've had it and you've got antibodies and you don't have the active disease, you could donate plasma, and that plasma can then be purified and infused into a patient who's ill. There's some early research on that one that suggests that it might be of some benefit. I know Mayo's been very aggressively working with that one. So that's one of those things that provides a little bit of hope. There's also some big trials on the antiviral agents, which are, I think, holding some promise. But long story short, those are all still early. We probably won't have good answers on those for another 2 weeks at the very earliest, and likely even a month or two. Typically, drug studies would take 6 to 10 months to several years to complete. So again, this is so much faster than what we typically do. So there will be times you'll hear, yeah, this is great, it's working wonderfully. And then a month or two later, you'll go, nope, it didn't work at all. Or you'll hear, this didn't work, and a month or two later, you're going to hear that, yes, it worked fine. So there's going to be a little of that back and forth that typically people don't see on the consumer or the patient end of the world that we occasionally see as healthcare providers, or we have time to sort out before it's actually launched into the general public. Yeah, vaccine, again, long story short, that's going to be the ultimate way to take this thing from what is this type of pandemic we're dealing with now to maybe something like an influenza or less or more, I don't know. But that's, like I said, a minimum 18 months out, so fall of 2021, I'm sorry. And I suspect it's going to be more like the spring of 2022 or even potentially later. There's lots of different types of vaccines that are being worked on. The question also becomes, once you give it the vaccine, are you getting the type of protection and for how long? So there's lots of work to be done on that.
Any other questions for Paul?
Yes, Paul,
Yeah,
I have a question. So my wife works for SureScript, which is a healthcare IT company, and they have extended their work from home order until June 1st at this point.
Yep.
Do you see that is possibly going to become a more common occurrence as companies are paying attention to the news and the forecasted timelines of how things are moving through the country?
Yeah, and again, I'll speak to this as kind of my best guess. So, and that's from, a local primary care doc as opposed to an epidemiologist or public health expert or any of those types of folks. I think that we'll see more and more companies do that. And I think there's a couple of reasons behind it. One is it may be just simply good public health policy, and that's yet to be determined, and that may become something that is required. The second thing I think is as companies become more comfortable with the whole work to home and how that's working and people adjust to it, they may decide that it's safer to keep their workforce at home rather than risk bringing them in, getting a whole bunch of people sick, and then you have the productivity losses from a large group of sick employees. So I think there's that combination. I think the third thing companies are looking at is sometimes it's easier to say it's going to be a long-term out and easier to walk that back to a shorter term as opposed to it's going to be 2 weeks and then it's going to be 2 weeks and then it's going to be a week and then a week and then a week, as opposed to, we'll just say it's June 1st and maybe we'll hopefully get it by early May or something like that. So I think those three things are in play, but other people may have different and more educated thoughts since you're actively in the business world.
Anything else for Paul? Zach?
I have a question for you, Paul, and for Tom too, if you're still on the line. Your opinion as a healthcare provider, Paul, and then Tom as an administrator. Whenever we roll this back a little bit, the essential services or maybe what's deemed non-essential right now that are lowest risk, for example, elective surgeries, will need to start. And right now a backlog is starting, right? So at what point do we, in your opinion, based on risk and not, and then economics as well, do we start implementing or getting into these elective surgeries again and trying to keep things safe but mitigating that risk so there's less of a backlog on the other end of this? When do we start doing well visits again? When do we start doing work on knee surgeries or whatever it is? As a chiropractor, I've got people that want to get in and get a cyst out of their knee, for example, but it's not a prudent thing to do right now. When will it be, from a Paul, with your expertise as a doctor, and then Tom as an administrator that needs to run a business, what's your opinion on that, guys?
I'll let Tom take the first shot at this one because I think he's
Go ahead,
close
Paul.
to that environment.
I'm sorry, do you want me to go first or were you going to?
Yeah, go for it, Tom.
Yeah, well, I'll share it like the hospital and the clinic here. And again, you have to take into consideration we're coordinating very closely with Hudson physicians. They do much more on the primary care side and we all kind of just partner together, different service lines. So with the hospital, our core services being essential services, the emergency department, our birth center, by the way, has been very busy. We've got things like our inpatient environment, med surg, our pharmacies, lab, imaging, those type of things. They're humming along and they're doing really well. So there's really not going to be much of a change there. But when it comes to elective surgeries or some of the specialty care services, by the way, infusion services, oncology would be part of that first category. It's really anyone's guess right now. Right now, we've extended the deferment of elective surgeries till May 4th. We're essentially making that decision, and we're doing that, we're evaluating it weekly in collaboration with public health and health partners and all the other healthcare systems, and of course with the governor's office and such. So long story short is at the hospital, for example, those key services, core services that people need for emergent care, plus the birth center and other things, they're going to continue status quo. It's just kind of a week-by-week basis right now. And those decisions are made in collaboration with what's happening across the government, public health, Department of Health, all the other health systems and such. If I had to guess, and you can't quote me on this, but if I had to guess, I'd say the elective surgeries will likely be extended out through May. And then hopefully we can start getting back to a more normal state starting in June. But it really depends on how that curve looks that Dr. McGinnis was describing. Is it going to be more of a episodic thing? Is it more of a elongated hill? How long are the tails on that kind of thing? But it's really going to depend on a lot of factors. Right now it's week by week.
I would agree. I would agree. A question about, will the total number of cases be the same with a flattened curve versus spike? And how about the amount of deaths? So long story short, I think that what we're seeing so far suggests that the amount of deaths would be lower because the healthcare system can keep up. I think that was one of the issues that Italy ran into. They simply couldn't care for everybody because they got just buried. Sorry, that was a bad choice of words. The total number of cases, hopefully because we're flattening the curve, would be a lot less. The problem is they stretch out over a longer period of time. So I think that I would have to hope and guess that they would be a lot less under the flattened curve. Certainly, if we flatten the curve early on, if you look at cases in Germany and the places, South Korea, some of the places that were New Zealand have been particularly effective. They are showing dramatically lower numbers of cases. So long story short, I think at the end of the day, what you're hearing is that this concept of the physical distancing, the staying at home, essential trips only, and then limited number of people's on those trips, those are the things that's the best medicine we have at this point in time.
Paul, thank you very much. Obviously a very timely update for all of us. And thanks everyone for dialing in today. We'll be back next week, same time, same place, same channel. So everybody stay safe this week, and we'll catch you next week. Thanks, Paul.
Okay. Hey, Paul, we miss you.
Thanks, Tom.
All right, see ya.
Have a great week, everybody.
Thank you.